The Sansom Institute has a long history of working with Aboriginal and Torres Strait Islander communities in research. This reflects the priorities of the University of South Australia in this area. What we want to create is culturally appropriate, sustainable solutions to the chronic health problems that cause disparities in this community. And we do this by engaging with the community to find out what their priorities are and then collaboratively finding the solutions to these health problems.
Research plays a critical role in overcoming the challenges faced in Aboriginal and Torres Strait Islander communities, whether it be around understanding what drives the high burden of disease, whether it relates to how we can build better systems of care to look after people when they're unwell, whether it's how we can prevent disease before it begins, and how we can build better policy that makes a difference in the lives of Aboriginal and Torres Strait Islander people across the country. So we've constructed over the last 5 years a unique program of work led by a unique group of young Aboriginal and Torres Strait Islander researchers of the future.
I'm doing a PhD looking at a set of national key performance indicators for the Aboriginal and Torres Strait Islander community-controlled health organisations. And I'm looking at the impact that introduction of those NKPIs has had on our services. So looking at what the barriers are, what the enablers are, and I'm hoping that what we actually come out with is a set of recommendations, or at least something that the ATCHOs can use to advocate when they're talking to government about future NKPIs.
We're trying to achieve a number of things. First and foremost, we've got a particular interest in understanding what drives the difference we see in outcomes for Aboriginal and Torres Strait Islander people. That's not simply an esoteric interest, so just knowing what the causes of the problems are is nowhere near enough. What we're trying to identify is solutions, working with communities, working with young people, working with the next generation, working with health services, working with policy makers and hospitals and healthcare environments to better understand the needs of Aboriginal and Torres Strait Islander people and communities, to build better ways of doing business, to build unique or novel approaches to overcoming disadvantage, and to fundamentally make differences in outcomes for people. That's what we're all about.
One of the pieces of work that we're actually doing now is working with the state government around child protection, and that's a response to the Royal Commission that we just recently had. We're hoping to get rigorous research evidence that can inform governments and agencies about how to work with Aboriginal kids and keep them out of care.
We're trying to build the next generation who can make a difference to the lives of their families, their communities, and the broader Australian society by utilising research and what we learn to build better approaches for all Australians.